reached out to you specifically, Beth, is because you have all these things in the medical community. You can help everything from administration at the highest level to those entry level students. Let's talk about the coronavirus, this whole thing that's happening. How is it affecting the industry from your standpoint?
Well, it's at this moment, I would say, for some of my coders who life is slowed down because of the virus, you know, we're very careful. We're not doing elective surgery. I know a lot of the fertility treatments have stopped. People are just not doing preventative maintenance on themselves, like they're not doing their annual physical wellness exams kind of thing. This is the time to really just kind of brush up on your skills. You know, if the world has stopped for a hot minute, like let's take the time and let's look at our denied claims, our rejected claims, our insurance aging. Where are we with that? Look at your skills. Do you want to brush up on them? Is there something you want to learn? Any of those things would be a great time to start working on. You know, we always say, well, when I have time, I'll do X. Well, you have time. This might be the time now. And so instead of just laying on our laurels, we should keep going.
Yes, I tell that to companies all the time. Like, this is a great opportunity for you to think about what you want to get out of your business, and what are the things that need to be changed, and who are the people that need some special training that you haven't had time to train with and focus on. So now there's going to be this incredible movement, even though right now it may be a slow, like you said, about the elective surgeries and things that are going on with that. There's going to be this massive wave that's going to happen once everything bounces back. Everyone's going to be scheduled now for those elective surgeries, and they're going to be scheduled for treatments and things that they need. And there's going to be an incredible need for coders and billers throughout the country. There's a great movement that's happening right now where a lot of people want to get involved in the medical community because of what's happening.
Right.
Are you able to support all those students that would be able to get enrolled? I'm sure that's probably a question because you handle students from all over the country. How are you guys able to support that?
We just keep going. Like, we have our online classes, we have our classroom classes, and we just keep growing and going, and we just expand our bandwidth, and we meet that need.
Let's just talk first of all about advanced coding services. What exactly is that?
So Advanced Coding Services, we are a school. We have an online presence, but we also have a classroom here in Arizona to teach people who want to learn how to do medical billing and coding. And coding is where the doctor writes a note and we decipher that. We take their words and make them into codes. And then the billing piece is where we send those codes to the insurance company for reimbursement. And that's exactly how the doctor gets paid.
The administration area, the people that are working the medical billing and coding, they are a major influence into the revenue that a doctor's office or a hospital or even insurance company. Understanding the codes, understanding why we do those codes are so important. Talk about how the impact of that administration, how is that important to a medical doctor or a hospital or an insurance company?
So the doctor can do all of the services that he provides naturally. He's a doctor, that's what he does. But unless he has a coder or a biller who knows how to do them correctly and per the payer contracts, he's not going to get paid for the services that he's rendered. And so it's important that he have somebody on his team that knows coding and billing, that they know how to decipher his words and his documentation to translate those into codes so that he gets paid for the services that he's doing. We are the heart of his cash flow.
Why would it be so advantageous for a student to actually participate in the school?
Well, so you not only get our curriculum, so we purchase our curriculum from AAPC, the actual writers of the CPC exam. And so you're getting their curriculum. So it's not like I've just made this up. You're actually getting the curriculum from the AAPC, which is the gold standard for coding and credentialing. So we use that, but then you also get our real life experience. I have been coding. I started coding when I was 2. So I've been in the industry about 25 years because, you know, I'm not 30 yet. But we have, you know, my dad and I started the billing service together, and we would offer extern sites. So coding students would come into our billing service and learn from us, and we would teach them, and they would spend about 4 to 6 weeks with us. And our exposure to them was that you are almost ready to graduate and you don't know half of what you need to know, because those big box schools just weren't teaching them what they really needed to know, real life kind of stuff. And we had almost every student that left us said, we learned more with you in 4 to 6 weeks than we learned at school, because we were teaching them real life stuff. And my dad and I had a dream that at some point we would open a school and teach them real coding and billing. So this was not just a book learning experience. They were really getting education that would be a career that would help them continue with life and be successful.
And that's so important. One of the things that, you know, your program is what, 12 weeks? It's a 12-week program?
Well, so our program can range from 12 weeks to 20 weeks, depending on how fast you learn. If you've already been in the industry and you just kind of need a refresher because you want to do your CPC exam, then yeah, we can do it in 12 weeks. If you're brand new and you've never been exposed to it, then I would recommend the 16 to 20 week program, because some people are smart, and it's not that they're smart, they just are fast learners. And so they might pick up this new language, because really medical coding is a whole new language that you're going to learn. And some people pick that up quick and they can do this in about 16 weeks. Some people, you know, it's a different struggle. Again, we have adult learners. Some people learn differently. They want to learn at different paces. And so we have the 16-week program. We also have a 20-week program, because it's just a lot of material and it's very intense stuff that you're getting through.
And one of the things that I remember you sharing with me is the importance of knowing the anatomy and knowing about the documentation. Talk about what you guys do at the school to go about making sure that your students are prepared with explaining that anatomy, explaining the documentation. How are you different from anything else that's out there?
Well, so a couple of things. One is that we have a separate course that's just anatomy and terminology, and that's about a 12-week program. So we have that separate that you can just sign up for. But part of our CPC program is that you will learn that. And so each week, so like chapter 7 is our integumentary, and that's your skin. And we talk about the skin and we break that down and we use those words, those terminologies in anatomy, and teach you each section, each organ system as we approach each system. So like chapter 10 is cardio. So we spend all of our time talking about the anatomy and terminology in association with the cardio system.
And so the student gets the benefit of understanding everything more in depth, because obviously you're not able to do proper coding and billing unless you get that full rounded understanding of all the things that are involved with what a doctor's office or a hospital, or just the terminology itself that's going to be explained in that documentation.
Correct. Right. You need to know when he says that we closed the lesion and it was subcutaneous, you need to know how deep that was. Was that deep or was that not? Is that a simple closure or a complex closure? You have to know what those terms are and what they mean, so that when your doctor documents that, you know exactly how to code that.
Can you talk to me a little bit about what the wages might be for someone who's first joining the school, someone or someone with experience? What's the anticipated wage salary that they can expect for something like this?
So certified coders, so you're CPC straight out of school, typically, now keep in mind that if you're brand new to coding and you're just starting out, you're probably going to be about $16 an hour. You could be a little higher depending on if you're in California or New York or in Phoenix. We're about $16. And that's because you're brand new. You're starting a brand new career. Can you work your way up from there? Absolutely. I personally know people in this industry who are making six-figure salaries because they have worked their way up. The potential is there. Now, if you work for a small doctor, he might not. Your pay is going to be dependent on what he can afford. And if you are skilled and you work really hard and get more money in the door for him, his cash flow is going to flow, and then there's more money for you to be paid. Hospitals, you know, their pay scale is going to be a little different than a physician's office depending on their funding. So some of that is dependent on where you are.
Yeah, I agree with you 100% on that. And let's talk about how that wage could vary based on how you even go into an interview, right? Whether you have minimal experience and however you might have a dynamic personality, you might be able to be a great communicator. You're able to maybe be more of an influence with helping facilitate some of those things that are happening in the billing. Right. But your wage is going to be congruent to your experience. Now, there might be people that are new to billing that they've never experienced, but there's also, and I'm very aware of this, there's a lot of people that are completely burnt out as providers in the medical community. They're medical assistants or they're nurses who don't really want to do that profession anymore. They want to be a part of the healthcare community, but they don't necessarily want to be doing that. A billing is a coding is a great transition for them if they're looking to do that. Would you agree with that?
Absolutely. I have had doctors who come through my school because they wanted to learn coding so that they were making sure that their cash flow was working and that they were getting the most money that they should. But I've also had MAs, the clinical side of healthcare, come through because they're just tired of working with patients depending on their population. That maybe they're just burnt out with where they were and they wanted to work on the administrative side. Maybe they just weren't able to be on their feet anymore, but they still wanted to serve their patients. This is a great way for them to do that. And coding, I mean, I'm just going to face it. If you look at my hips, you'll know coding is a on your butt job. Like there's some walking around, but a lot of it's really just sitting. And so some of these nurses who are used to 12 and 15 hours on their feet, they still want to be clinical. They still want to be involved in healthcare, but this is a great bridge for them to still be involved.
And it's also advantageous for the doctor's office or the hospital because
absolutely,
people that understand the language, they're getting people that understand the documentation, they're getting people to understand what needs to be put on there that may have not been done by someone who may be new in the industry. Would you
absolutely agree? Absolutely, because if you're a registered nurse, you're going to know all of those terminologies. You're going to know what those procedures are and what's involved in them, versus somebody who's non-clinical might not understand that. You're also going to know the process of certain diseases. And so absolutely, if you're already in the healthcare industry and you're on the clinical side, this is a great natural path if that's something that you're interested in on the administrative side.
And let's talk about, again, going back to the school, depending on the weeks, you said it's either 12 weeks or it could be 20 weeks. It all depends on your level of experience. That still alone is an incredible opportunity for who's wanting to learn, especially online. Right. You have these 4-year programs, which can cost up to $20,000 to go to school, or you can invest in a minimal amount and get the most at the end of your graduation. Right. Talk to us a little bit about that. Like, how advantageous is it for someone even though they're going through a shorter period of time, they're still getting everything they need to be qualified in the industry?
Absolutely. Because I mean, even if you do the 12-week or the 16-week or the 20-week program, at the end of that time, you're going to get a certificate of completion. And so in five short months, you could be certified as a professional coder, working in the industry, already making money, and you have not gone 4 years and thousands of dollars in debt to make that happen. 5 months, and you could already be working.
Yeah, and I did some research before our interview today, and one of the things that I was looking at for an hourly rate, just to kind of talk about what's possible, and I agree 1,000% with what you said about people can be making 6 figures if they've been in the industry, like a registered nurse, and they're in the hospital department. But I show a medical billing specialist can make up to about $42,000 a year, that averages about $19.85 an hour. A medical billing clerk can make about $38,780. That averages around $18.64 an hour. A medical records coding manager can make up to $71,000. Yeah. That ranges about $33.85 an hour. And then medical records coding technician make around $54,000, which averages around $26 an hour. So,
and some of those are dependent also on whether you're certified. Could you be working in the coding and billing field without being certified? Absolutely. Are you going to get more money if you're certified? Absolutely.
And let's talk about that, because the AAPC is an accredited organization. Talk about what the AAPC is.
So AAPC is this amazing entity that started, I think, in 1985, and they are actually the gold standard for certified coders. They actually started out as the American Academy of Professional Coders. They then became the American Academy, they were the American Academy of Professional Coders, became the American Academy of Professional Coders, and then because healthcare has just exploded and gone in many directions, they're just the AAPC now because they have all kinds of credentials. So I actually have 10 different credentials, and all of those are because I just have this passion for learning, and I want everybody to know every piece of information that they can. And so I have all of those different credentials because not because I want to show off, but because I want to be as educated as I can be. I love learning and I love education. And so some of those are coding credentials, some of them are billing credentials, some of them are auditing credentials. So that means like I can audit the doctor's documentation to make sure that what they're documenting and what they're billing match. I also can do compliance. We have to talk about Stark and some anti-kickbacks, some, federal regulations that we have to be careful with. But I'm also a certified instructor, and that's really my passion. I love teaching. And as I teach people and their eyes light up, that I know that they've gotten that concept, and I just love that because I know once they got that, they bit the bug, and they're ready to just jump into this field.
And the advantage too is if there's a medical office out there, maybe they have some really good people that are working up front, but they don't necessarily have all the skill sets yet. Those
Right.
doctors can enroll their staff into the class, right? I mean, if you have a star person, you could always enroll a star person in your office in the program.
Right, absolutely. I actually currently have a girl, and I love her. She is so cute. She works for a doctor, and she wanted to learn coding, but she didn't know how to do it. And he needed somebody who knew coding, and he called me and he said, "So you teach coding?" And I said, "Yes." And he said, "Can I send my girl to you? Will you teach her?" And I said, "Sure, that's what we do." And suddenly, and it's so cute because now she's like, "Oh my goodness, now I understand why that code was used and why this code wasn't used." And she brings me her documentation. So when we have class, she comes to class and she's like, "Hey Beth, can you help me with this? So like, here's a chart I wasn't sure how to code. Can we code this?" And so we actually code it together in class. So she understands the concepts and the other students get the benefit of that. And so now we've all gone through that process. And so, we wait a couple weeks and we're like, "Hey, how did that work?" She's like, "It got paid and it was wonderful. My doctor's so excited because we helped him get a claim paid that he had been working on for a very long time." And she brought it to class. We worked our way through it. He got paid on it. He got paid thousands of dollars on it because we helped her code it correctly. And so he got reimbursed for their services that he provided. And he's like, it was worth every penny to send her to school just to get that claim paid.
I love that. And it's so often I love when doctors recognize they have good people.
Absolutely.
Because that's so important. And, when we talk about billing and coding, it's your revenue for your business, right? If you have the right people, that could be the one thing that's either keeping your doors open or closed. If you don't have the right people doing billing, I've seen mistakes happen in offices where they didn't have the right people in their billing and coding office, and claims are getting rejected. They're not getting paid. It's devastating to the practices.
Absolutely. Because if a claim gets rejected or denied, then as a coder, if I have the passion for coding and billing, I'm going to go back in and fix that until my doctor gets paid. And that's what you need. You need somebody who has that passion and loyalty to the practice that's going to work extra hard to make sure we've got that. And I'm going to tell you, my coders, every certified coder that I know, that is who we are, because our role is to make sure our doctors get paid everything that they're entitled to.
What are the most common questions that you get for like new students that want to enroll in the class, whether it's online or they're in the Phoenix office at the campus? What are the questions that you commonly get asked by students?
So most of the questions that we get are, how long is the program? Is there a certification? Like, is there a certificate of completion at the end? Like, what do I get at the end when I've completed this? How long is the exam that we have to take? So here in my classroom and online, I give you all the curriculum, and we do midterms and finals just like a real college course. But that's only a piece of the puzzle, because then you have to sit for your actual state or national boards, which is your CPC. That's your Certified Professional Coder. So you actually have to sit for that exam. So a lot of the questions I get is, how long is the exam? How many questions can I miss and still pass? How many questions? How long is it? I also get a lot of questions like, how long is the program? How much does it cost? What's included? Is it hard? How long before I start making money? How much money should I expect to be making? Those kinds of questions, most of which we've already gone over, because you are correct. Those are the questions everybody asks. Like, what does this look like? And I get some of, why do I want to do coding? Or somebody told me I wanted to do coding and I don't know what it is. Can you tell me what it is? So we talk about what medical coding is and how that works. And the difference between coding and billing. There is a difference. In some practices, you're going to wear the same hat. In some practices, you're going to wear completely different hats. And sometimes your coding mind is going to war with your billing mind, because you need to code it correctly, but your payer contract says X and your coding mind says Y, and you have to make sure that they're working together. What takes precedence? And it's going to be probably your contract, because you want to get paid.
I love that you mentioned that, but let's talk about contracts, insurance contracts, agreements. That's something that's so important, because you're talking about so many different insurance companies,
right?
The agreements that these doctors have with these insurance carriers of
Yes.
knowing what they can charge, what kind of services, how they need to be coded in order to get paid. These
right.
are all things, that language and that dialogue can be different for different insurance companies.
We teach about your doctors and their contracts and their payers. I can't get into specifics, because just like every contract is different, so Blue Cross is different than Aetna, it's also different per specialty, per payer. Your provider might be a pediatrician, and his contract with Blue Cross is very different than the pediatrician in Scottsdale, who also has a contract with Blue Cross. Each of them are very different. So we talk about what those look like and how to read them and go through them, so that you know what you need to know for your practice for each payer. And sometimes it's just, you're going to have to go back to your contract. Sometimes it might be a call to your provider rep to see if you can figure out what that answer is, and work with them to understand what they want from you, so that you can provide that information to them.
What would you say to someone out there that is maybe at home, they're thinking about a career change, they're thinking about things that they want to do, they haven't necessarily stepped up to it yet? What would be your thoughts to them? What could you say to them to help them understand that this is really an opportunity for them to grow?
I would say, if this is a thought that you have had, if this is a burning desire that you have had, now is the time to do it. If you want more information, I'm happy to always have a conversation with somebody who just isn't sure if this is what they want. They want to know more information. I'm happy to have that conversation with you. Here's the thing: if you want to do this, I'm happy to get you involved. If you want more information because you're just not sure if this is the right thing for you, I'm happy to do that, because I want you here because you want to be here and this is your passion. If you think that you're just going to get rich working from home, this is not what's going to happen. I mean, the reality is that you're going to have to go through school, you're going to have to learn this, and you're going to have to take your lumps like everybody. You're going to have to start at the beginning and start at a brand new coding career and work your way up. Can you be working from home making $60,000 a year? Yes. Is that going to happen right out of school? No. But it's possible. I said I have friends, personal friends that work from home. They make six figures. They've been doing this a while, so it's not like it's a right out of school thing.
Well, I cannot thank you enough. I'm so glad that we had an opportunity to talk today, and I'm sure we're going to have many more conversations about this. Again, for anyone that's watching out there, if you are someone looking to transition your career, maybe you're someone new in the medical field, or maybe you're someone that's been in the medical field for years and years and years, and you're now just looking for an opportunity to transition into another area, the medical billing code and a profession is something that is in high demand. Obviously, it's going to be something that's going to be advantageous to not only the doctor's office, a hospital, insurance company. There's so many areas that they're going to need you for that profession, and this is a great opportunity to be able to enroll. It is an online program that you offer, again, Beth, right? It's an online program. There's also a school here in Phoenix. It's an on-site campus that you can go to. The classes are between 12 weeks to 20 weeks, depending on your level of experience. Is that correct?
Right. The online classes are 12 to 20. The classroom classes are all 20 weeks.
Are all 20 weeks. Wonderful. And they can get a hold of you at advancedcodingservices.com, or they can get a hold of you by what's your phone number, Beth?
The school phone number is 602-469-1193.
All right, honey. Thank you so much for joining us. And we'll talk to you very soon.
Great. Thanks for having me.
You're welcome, sweetie. Have a great day.
Thanks, you too. Bye-bye.